Understanding somatic dysfunction, a cornerstone of osteopathy. Osteopathy is a distinct and holistic approach to healthcare that emphasizes the intricate connection between the body's structure and its overall function. At the heart of osteopathic philosophy lies the concept of somatic dysfunction. This refers to impaired or altered function of the body's musculoskeletal system, encompassing muscles, bones, joints, and connective tissues. Osteopathic practitioners believe that addressing somatic dysfunction is crucial for optimizing health and well-being. Imagine a complex and finely tuned machine like a clock. Each gear, spring, and lever must work in perfect harmony for the clock to keep accurate time. Similarly, our bodies rely on the seamless interplay of various systems. When one component, such as a joint or muscle group, experiences dysfunction, it can disrupt the rhythm of the entire system. What is somatic dysfunction? Somatic dysfunction represents a significant deviation from the normal state of health within the musculoskeletal system. It encompasses a range of impairments that affect the muscles, bones, joints, and connective tissues, leading to alterations in their normal function. These changes can manifest as restrictions in movement, tenderness to touch, pain, and even asymmetry in posture.
Unlike structural disorders like fractures or dislocations, somatic dysfunction often involves subtler alterations in the quality of tissue texture, tension, and mobility. Imagine a piece of fabric that has become twisted or bunched up. The fabric itself is not damaged, but its function is compromised. Similarly, in somatic dysfunction, the tissues themselves are not inherently damaged, but their ability to move freely and function optimally is impaired.
This dysfunction can arise from a multitude of factors, including everyday stresses, poor posture, repetitive strain injuries, and even emotional tension. Over time, these factors can lead to the development of tightness, stiffness, and pain in the affected areas. Osteopathic practitioners employ a systematic approach to diagnose somatic dysfunction, relying on a set of criteria known as TART. This acronym stands for tissue texture changes, asymmetry, restriction of motion, and tenderness. Each component provides crucial information, allowing practitioners to pinpoint the location and nature of the dysfunction.
Tissue texture changes, palpation, or the skilled use of touch, allows osteopathic practitioners to assess the quality of the tissues beneath the skin. Changes in temperature, moisture, elasticity, and texture can indicate underlying dysfunction. For instance, muscles in spasm may feel tight and ropey, while areas of inflammation may present with increased warmth and swelling.
Asymmetry. The human body exhibits a natural symmetry, with both sides generally mirroring each other. Osteopathic practitioners look for any deviations from this symmetry, such as differences in muscle bulk, limb length, or spinal curvature. These asymmetries can provide clues about areas of potential dysfunction.
Restriction of motion joints are designed to move through a specific range of motion. Somatic dysfunction often manifests as a limitation in this normal range. Osteopathic practitioners assess the ease and quality of movement in various directions, noting any stiffness, pain, or resistance.
The science behind the dysfunction, unraveling the mechanisms of somatic dysfunction. While the concept of somatic dysfunction has been central to osteopathic practice for over a century, scientific understanding of its underlying mechanisms continues to evolve. Researchers are uncovering the intricate interplay of factors that contribute to the development and perpetuation of this dysfunction.
One prominent theory is that of segmental facilitation. This concept posits that when a specific area of the musculoskeletal system experiences stress or injury, the nerves in that region become hypersensitive. This heightened sensitivity can lead to a cascade of effects, including increased muscle tension, reduced blood flow, and the accumulation of inflammatory mediators. These changes, in turn, create a vicious cycle, further perpetuating the dysfunction.
The affected segment becomes stuck in a state of heightened activity even after the initial stressor is gone. This can result in persistent pain, stiffness, and impaired movement. Moreover, somatic dysfunction does not remain confined to the affected segment.
Osteopathic practitioners possess a highly refined sense of touch, using their hands as diagnostic tools to identify and assess somatic dysfunction.
This hands-on approach, known as palpation, allows practitioners to gather a wealth of information about the state of the musculoskeletal system.
Through careful and systematic palpation, we can detect subtle changes in tissue texture, temperature, moisture, and elasticity that may escape detection through other means.
Before even touching the patient, osteopathic practitioners begin their assessment with keen observation. They look for asymmetries in posture, gait, and body mechanics, noting any signs of pain or discomfort. This visual inspection provides valuable clues about areas that may require further investigation.
Once the initial observation is complete, we use our hands to explore the tissues beneath the skin. We employ varying degrees of pressure, from light touch to deeper palpation, to assess different layers of tissue.
This allows them to identify areas of tenderness, muscle tightness, joint restrictions, and other signs of somatic dysfunction.
In addition to static palpation, we also assess the quality and range of motion in various joints.
Osteopathic manipulative treatment, or OMT, lies at the heart of osteopathic practice, encompassing a diverse range of hands-on techniques designed to address somatic dysfunction and restore proper musculoskeletal function. These techniques are gentle, non-invasive, and tailored to the individual needs of each patient.
Muscle energy techniques engage the patient's own muscle contractions to release muscle tightness and improve joint mobility. The practitioner guides the patient through specific movements while applying resistance, prompting the muscles to relax and lengthen.
Articulatory techniques involve rhythmic, gentle movements to help improve joint mobility and range of motion. The practitioner applies controlled forces to the joint, moving it through its natural range of motion to restore normal mechanics.
Myofascial release focuses on releasing restrictions in the fascia, a thin layer of connective tissue that envelops and connects muscles and organs throughout the body. Using gentle, sustained pressure, practitioners help release fascial restrictions, improving mobility and reducing pain.
While osteopathy has a long and rich history, its principles and practices are increasingly being validated by scientific research.
Studies are demonstrating the effectiveness of osteopathic manipulative treatment, or OMT, for a wide range of conditions, from back pain and headaches to asthma and digestive issues. Research has shown that OMT can be an effective treatment for both acute and chronic low back pain.
A study published in the Journal of the American Medical Association found that OMT was as effective as medication in reducing pain and improving function in patients with acute low back pain.
Moreover, other studies have shown that OMT may be more effective than conventional medical care in reducing pain and improving function in patients with chronic low back pain. Beyond back pain, OMT has also demonstrated promise in managing other musculoskeletal conditions.
While somatic dysfunction originates within the musculoskeletal system, its impact extends far beyond muscles and bones. The interconnectedness of the body's systems means that dysfunction in one area can have ripple effects throughout the entire body.
Restrictions in the thoracic spine, ribs, and diaphragm can impede breathing mechanics, potentially contributing to shortness of breath, reduced lung capacity, and even recurrent respiratory infections.
Somatic dysfunction in the thoracic and lumbar spine can affect the nerves and blood vessels supplying the digestive organs, potentially leading to heartburn, indigestion, constipation, and other digestive disturbances.
The nervous system relies on the proper movement of the spine and cranium for optimal function. Somatic dysfunction can irritate nerves, leading to pain, numbness, tingling, and even referred pain patterns where pain is felt in a different area than the source of dysfunction.
Restrictions in the musculoskeletal system can impede blood flow, potentially leading to swelling, coldness, and a buildup of metabolic waste products. This can compromise tissue health and impair healing.
As we have journeyed through the intricate landscape of somatic dysfunction, we've uncovered how seemingly isolated issues within the musculoskeletal system can ripple through the entire body, affecting everything from respiratory function to digestive health. Understanding somatic dysfunction is not merely about identifying a source of pain, it's about recognizing the profound interconnectedness of our bodily systems and how they work in harmony. The gold standard for diagnosing somatic dysfunction lies in the skilled hands of osteopathic practitioners, who use their expertise to detect subtle changes in tissue texture, alignment, and movement. Their hands-on approach is grounded in a deep understanding of human anatomy and physiology, allowing them to restore balance and relieve pain effectively. Scientific validation continues to bolster the principles of osteopathy, highlighting its impact on overall health and well-being. From advanced imaging techniques to emerging insights into the gut-brain-fascia axis, research is expanding our comprehension of how somatic dysfunction develops and how it can be treated. Osteopathy's holistic approach is pioneering a new era in healthcare, one where the focus is on treating the whole person rather than just the symptoms. By addressing the root causes of somatic dysfunction, osteopathic treatment aims to restore harmony within the body, promoting optimal health and relieving pain. In summary, understanding and diagnosing somatic dysfunction is crucial for achieving holistic health. Osteopathy stands at the forefront of this endeavor, offering a compassionate and comprehensive approach to healthcare that honors the intricate relationships within our bodies. As we continue to explore and validate these principles, we move closer to a future where every individual can experience the profound benefits of restored balance and well-being. Stay tuned as we delve deeper into the pioneering advancements in osteopathic research and its wide-reaching impact on health and wellness. As we stand on the cusp of a new era in healthcare, osteopathic research is poised to play an increasingly vital role in advancing our understanding of the body's interconnectedness and the profound impact of somatic dysfunction on overall health.
Investigating the mechanisms of somatic dysfunction is crucial. While we are beginning to unravel the complexities of somatic dysfunction, further research is essential to fully elucidating the intricate interplay of factors that contribute to its development and perpetuation. Advanced imaging techniques, such as ultrasound elastography and diffusion tensor imaging, hold promise for providing more detailed insights into the biomechanical and neurological changes associated with somatic dysfunction.
Emerging research suggests a fascinating link between the gut microbiome, the nervous system, and the fascial system. Osteopathic researchers are investigating how imbalances in the gut microbiome can influence fascial tension and contribute to somatic dysfunction.
This research could lead to novel therapeutic approaches that target the gut-brain fascia axis to address a wide range of health concerns. Osteopathic researchers are also exploring the use of biomarkers, genetic testing, and other personalized medicine approaches to tailor OMT treatments to the specific needs of each patient.